Hello again, friends and family. I didn't expect to be here so soon offering another update on my health situation, but things have developed quickly over the past couple of days regarding my deep vein thrombosis and pulmonary emboli. I returned to the emergency room very early Saturday morning because I woke with a chest pain that wouldn't go away. They did end up running a CT scan with contrast to confirm whether or not I had pulmonary emboli. There were none visible on the scan, but I continued to feel this pain. And so the ER doctor at that hospital, which was a different hospital than the one I'd visited before, said he just wanted me to operate under the assumption and pay attention to my body as if we had confirmed that there were some tiny emboli in there. And so just to be really cautious and aware. He gave me really good instructions about what to watch for and when to potentially return to the emergency room. Fortunately, since that time, I have not had to return. I am feeling a bit better daily with the Eliquis. My body is feeling better. The heart flutters are actually reducing in frequency and definitely reducing in severity. So I, not being a medical professional, think my intuition is telling me that that heart fluttering does have to do with the clotting of my blood. However, I have several follow-ups that I have to attend with different medical professionals, and the first one was yesterday. And that was quite a wake-up call. I went to my women's health clinic, again over at Providence, and I had been seeing, there were two practitioners there that I was seeing, a nurse practitioner and then a physician's assistant who had been helping me through these perimenopause symptoms for about the past 2 years. But this time, I went ahead and made an appointment with a new physician at that office, and the appointment was an eye-opener. First of all, the easy things: no more hormone medication for me of any kind ever. That's not a big surprise. But we know now that I'm sensitive to estrogen in particular, and so that will not be on my future formulary of medications, and I don't want to be on it anymore. For some of my menopause symptoms, I was also using a topical cream that has estrogen in it, and though they don't believe it's systemically absorbed, and they don't believe it probably contributes to this blood clotting situation, I'm still, out of an abundance of caution, going to stop using it for now. Part of the reason I got on these medications was because I have horrible hot flashes. I've had a terrible time sleeping at night. I don't feel them during the day, but they come upon me at night and they drench me in sweat. And when I wake up, I cannot go back to sleep. And that was really affecting my quality of life. So the doctor yesterday told me that if those hot flashes return, now that I'm going off the hormone medications, she would like to prescribe a selective serotonin reuptake inhibitor, or SSRI. Some of you may be familiar with this as an antidepressant. It's an off-label use that has now been approved by the FDA for these antidepressants. And she's got in mind a couple that she would recommend for me. We're going to hold off on that for now because there are a lot of other steps that she determined yesterday that she wants to take to help figure out what's really going on with me. So, what are we going to do about all of this? First of all, I'm going to have a uterine sonogram because we know I have uterine fibroids. I had one in January of this year. And I had one last year through this whole process of working on my menopause symptoms and the difficulties I've had there, my gynecological symptoms. But this doctor now wants to see a comparison from January, which was before I began the hormone medication, until now. So I'm going to be doing that on July 8th to see what the lining of my uterus looks like and to measure my fibroids again. And I'm looking forward to that to get a little bit more data. After that, she wants to perform a biopsy on my uterus to rule out uterine cancer. She does not seem to think that that is going to be the problem, but she has a high level of concern because, as it turns out, when I began experiencing all of these symptoms, 2 years ago, I should have been, these are her words, I should have been tested at that time for uterine cancer. Unfortunately, the care providers I was seeing did not choose to recommend or order that. And the doctor I was seeing yesterday expressed visibly and verbally her frustration that this test has not been performed yet. That gave me a little bit of pause and fear, because if a cancer is growing, I truly, my intuition tells me that's not what's going on. But if a cancer is growing, it's now had 2 years to establish a greater foothold in my body. And that is, of course, a frightening prospect. Now, all of that said, I believe everything is going to be okay. I trust my body. I know that it's going to do what it knows how to do and heal itself as well as it can. We'll continue to consult Western medical professionals and follow all of their recommendations. And I'm very thankful to have this doctor in my team now who is taking all of this very seriously and acting with alacrity on all of it. She wants us to do all of these things within the next 3 months. So when I do have the biopsy of my uterus to rule out the cancer, hopefully, she will also replace my Mirena, and that's the IUD I mentioned in my prior update. The Mirena helps reduce excessive bleeding in addition to preventing pregnancy. But for me, the greater use was to help control these other perimenopause symptoms. So I've had the current one that I'm implanted in me for about 4 years. In July, it'll be 4 years. So she said sometimes they have reduced effectiveness, the Mirenas do, after a couple of years. And so she likes to potentially replace them sooner than the 5-year official mark of when it can continue preventing pregnancy, or for how long it's approved to continue preventing pregnancy. So when she does the biopsy, she is planning to replace the Mirena. I don't have a date for that yet, for that procedure yet, those procedures, but they're going to be pretty quick. However, what she did tell me is that before she's going to do the biopsy and the new Mirena, she needs me to see a hematologist and to have a Holter monitor for 3 to 7 days to monitor my heart rate, because she suspects that what I'm experiencing are transient episodes of afibrillation, and she says in her experience, hormones cannot be the cause for this, and she wants to go to a doctor who's professional in this and experienced and find out exactly what is causing these heart fluttering feelings that I get. So, and then the hematologist, of course, to follow up about the blood clotting and make sure that I don't have any other disorders. So I am looking forward to those appointments. They've been ordered and not scheduled yet. I am feeling better. My body feels better, as I mentioned early on in the update. I'm continuing to have strange little pains that move around my body. I'm attentive to them, but now with the added information from the new emergency room doctor that I saw late Saturday night, I feel a lot more confident about what's happening to me being normal and not worrisome. One side effect of the Eliquis that I knew was a possibility, or I knew would happen, but hadn't realized how extreme it would be, is how easily and quickly I bruise. I whacked my knee yesterday getting out of the car at the hospital, and it bruised within an hour and has a big lump on it, and it's pretty painful today. And then I had a failed, wrong arm. I had a failed IV attempt last week at the hospital, and I have this lovely bruise that's still lingering around. It's gotten even worse with the Eliquis and has spread. So that's another side effect that I wasn't necessarily prepared for, but it's been interesting to experience. So thank you for checking in. I am concerned, but I'm staying positive. I'm going to follow my doctor's instructions. I'm going to get all this done as quickly as I can. And I'm so thankful that Justin and I have really good health insurance, and we'll be able to do all of this in very short order. Just wanted to stop by and say hi and thank you for all the prayers and everybody who's reached out and expressed their concern and their love for me. I've heard from all of my friends around the world. It's amazing. I have a wonderful soul sister in South Africa who's sent me Reiki and made calls to me, and a client and soul sister in India who's right there with me and praying all the time. And then last night I got to meet a new friend, a new soul sister in Canada. She's 82 and she's a twin flame, and she's on this journey. And it was so amazing to talk to her. And she prayed with me and for me, and asked the intervention of the angels in my situation. So I'm really fortunate to have all of these people. And then, of course, there's everybody around the US who's part of our support group. And I'm so thankful and blessed, Justin and I both are, to have you all, and to have all of our family who's concerned and praying for us and offering support. Thank you. Remember, again, always listen to your intuition, listen to your heart, take care of your body. If you know something's wrong, follow up. I'm looking forward to this odyssey. I'm looking forward to learning more about what's going on with my body and taking back control from these pharma drugs that I've been using that have created unwanted side effects. Thank you all. Love you. Whoever you are, wherever you are, I love you. See you soon.